So, very good day to all. A warm welcome for our viewers joining us from the globe like USA, UK, Canada, and beyond on this live interactive session featuring one of the world's senior most Ayurvedic consultant and autism specialist, Dr. Navdeep Sharma ji, who has already proved that everyone has a mountain to climb, and autism has not been once mountain, but yet it has been their opportunity for victory. So, thank you, Dr. Navdeep Sharma ji, for joining us today. Actually, we have received several questions from our members and they just want your expert advice on that. But before starting your questions, I just want to tell my viewers to join our live session as members and become the part of the same. And because it's a priority to take your questions from the members first. And
So I would also like to thank you because this is an important topic and we generally get across you guys on Wednesdays. And again, it was my duty. This was the international one. And we are again there with you. And your questions are always our priority. And as I always say, autism is a temporary phase in the life of a child if treated time. Now, the timely is really very important. And while many of you are already with their kids in the process of saying goodbye to this disease, and many of you are there with us, with our organization, with our doctors for various other ailments, believe us, when we talk about Ayurveda, it's always authentic Ayurveda that we go for because your safety is utmost important to us. And that is why any herb that we are using, any guidance which we are giving to you, will always taken well care of. That the same combinations are used for you which we won't be hesitant in using for our families. So yes, definitely your questions will be our priority and we'll be moving on to those one by one. Yeah.
okay, Doctor Sir, the first question is from Mr. Ivan who asks, our son has been undergoing treatment for the past 7 months, and we would like to understand the role of in-house treatment for his recovery. And also, I want to ask, is Panchkarma mandatory for every child?
So I would say there's a mixed answer to this question. And first of all, thanks Ivan for joining us and thank you for taking treatment from us, showing faith on us. And yes, you want to know that Ivan, who is now improving with the help of Ayurveda and who is taking treatment from us, whether he requires Panchkarma and whether he requires in-house treatment with us. So I would like to tell you over here is that see, when we are guiding something to you at your own place, it is our psychotherapy team which guides you. You follow those things and make minute changes in your child's life, and they really pay off. But then, if you really want a child to come out of autism and come out of it quickly, and specifically in a country like US from where you are, the time is something which is very tough to manage for a child. We are ourselves taking care of everything, the earning, the daily chores at home. So a very less time is left to work diligently on the child. Whereas a child who's suffering from autism requires at least 4 times more and greater time than a normal child. So when a child comes to us and is there with our in-house treatment, there's a huge team working for your child. Our therapists just act like the parents for your child. They do everything they can do. And with the teamwork and with your involvement in that, that quickens up the treatment. And at the same time, you learn a lot, which is partially learned when we are guiding you through video conferencings and other sessions. So, yes, if it is possible for you, there is no other substitute for in-house treatment that really helps. But for 70 to 80% of you where it is not possible, you still can carry on taking treatments at your own place. That will also be a benefit. Yeah.
Thank you, sir. Your guidance and the efforts of your team are really appreciable. And let's moving on to our next question, which comes from Dorothy from UK. And she's saying, hello, doctor. This is Dorothy from UK. And I would like to know how herbs can benefit an autistic child. As parents, we are always concerned about giving medications. What is, can therapies alone ensure a holistic recovery for an autistic child?
So, Dorothy, first of all, your question is pretty genuine. Had I been, if I talk about my kids, I am also very conservative on what I want to give to my kids. Parents are always very tensed when they need to give something to the child to eat. And herbs, although we know that there are no harmful effects of herbs if they are taken under the supervision of a medical advisor, like we have a huge team, there are no such side effects. But still, the parents are really very apprehensive of using herbs. So you just asked a simple thing: can we do without the herbs? My answer is in some cases, yes, we can do without herbs also, but that requires then a thorough analysis of your child. For that, you need to connect with through video conferencing to our team, or preferably you can be there at one of our centers for those analysis. But if we talk about the fact that if there is no analysis that has been done as of now, it's always advisable to take herbs because if we can take herbs, herbs can really make a child positive about expecting accepting any kind of guidance which is being given to the child. Because in most of the autistic kids, what we see is that the child is hyperactive. Now, if a child is hyperactive and is not giving any heed to what the parents are guiding the child, if the child is not concentrating, if the child is not responding, at times it will become tough for you as parents to be just relying on those therapies, because the child is not going to listen to you. The child is not going to notice what is being done for him. So over there, if we are using some herbs, those herbs, they really modify the behavior patterns of the child. They make the child less hyperactive. They make the child more in the cognitive skills. The child now starts visualizing what you're doing for him. The child now starts getting involved in any kind of activities that you're doing. And with the help of our experts, which we provide to every patient who's taking treatment from us, those activities are planned in such a way that slowly and gradually the child, he starts showing responses. So yes, if you really want to do without herbs, we are there for you. We have got a lot of stuff without herbs also. But if it's possible for you, if you believe on us, because many of our herbs are FDA inspected, many of our combinations are allowed in most of the countries around the globe, and we are GMP certified, we are ISO certified, we are NABH certified, we are organic certified. You name the certification and we have it with us. The reason for that is your child safety is of utmost important to us. We want to keep your child pretty safe. Autism is a temporary phase in the life of a child if treated timely.
Patient name, Parth, age 3 years, disease, autism. Chief complaints, speech delay, hyperactivity, irritative behavior, less interaction, less understanding. The parents of the child consulted Dr. Navdeep Sharma on April 2023 at 1:09 p.m. and felt the scope of treatment to work for the child. He did not respond clearly and showed irritative behavior most of the times.
करो
आ जाएगा वो। कलर करो, वेरी गुड पार्ट, कलर करो। नो, इस हैंड से कर, वेरी गुड, इसके अंदर रख दो, वेरी गुड। पापा का हैंड, दीदी का हैंड करो, हैंड हैंड, चलो, वेरी गुड, खाओ, वेरी गुड। हेलो पेरेंट्स, पार्थ हेलो करो, हेलो करो। ये पार्थ है, मेरा बेटा, 4 साल का होने वाला है। लास्ट ईयर जुलाई में हम डॉक्टर नवदीप शर्मा सर के यहाँ पहुँचे थे। हमें एक सर ने मेरे बताया था सर के बारे में। हमने सोचा भी नहीं था कि आज 9 महीने में पार्थ मम्मा पापा हमसे बोलेगा इतनी जल्दी। हम तो मतलब बड़ा एक माँ पेरेंट्स के लिए एक रहता है कि कब हम मम्मा पापा सुनेंगे पार्थ के मुंह से। आज पार्थ मम्मा पापा और विद सेंस सब कुछ बोलता है। भगवान की कृपा से और सर की मेडिसिन और सर के गाइडेंस से आज 9 महीने में पार्थ एक नियर टू नॉर्मल लाइफ जी रहा है। और स्कूल में भी पार्थ प्ले ग्रुप में था। अभी जस्ट 15 दिन पहले ही स्कूल में मैम ने बोला कि पार्थ को हम नर्सरी में भेजेंगे। और जो सर ने जो लाइफ में हमारी खुशियाँ दी हैं, बहुत पेरेंट्स के लिए इससे ज़्यादा और क्या हो सकता है कि उसका बच्चा इतनी जल्दी और इतना अच्छा इम्प्रूवमेंट हो जाए, एक पेरेंट्स के लिए बहुत बड़ी बात है। थैंक यू सर, थैंक यू वेरी मच। हमारी लाइफ में इतनी बड़ी